I think for us, the thing that we're really keen for this project to achieve is to look at different ways of being able to address and support young people with mental health issues across our region. We'd really like to ensure that we know what the impact of different interventions that we would like to do or that might be good to do within our region, and just to understand the impact of those, to make sure that we're putting really valuable resources and resources that are also very scarce. We want to make sure that we're putting them in the places that matter most and are going to make the biggest difference for young people.
So I think one of the things that we've traditionally struggled for is is being able to actually use data to predict what we need. It's often a lot of anecdotal kind of reports or kind of trying to get a sense of what our community needs. And I think by having this tool, it'll really allow us to have a comprehensive forecast of what we have now, but also what we need into the future.
But I think it sounds wonderful, just the technique that can be applied without buyers from different services who always want to promote what they think is best, including myself. And I think including lived experience in that is so important. I think they've done a wonderful job of that today, getting a lot of young people here.
I think it's amazing. I think that you never know the full story until you get everybody in the room. And I've been able to be a youth representative in a few different things. And I think it's absolutely life-changing that you can have the people with the power, with the people that need the assistance, and to just put them in a room together really makes a huge difference.
So I think that a lot of stuff gets developed, a lot of apps, a lot of technology-based services, a lot of programs generally get developed without input from the community, from young people, from people with lived experience, from people who are or have been working in the field for maybe years and years and years. And I think what's really cool about, for example, phase one here is that we've got everyone from the community, a lot of people representing different areas and regions within the community. We've got people with lived experience of mental illness. We've got people from NGOs and government sector, local schools, and so on. So I think that we're going to get some really, really rich information from the local community in this workshop.
So what I loved about today was just how many diverse people there were, and just the amount of youth was just awesome, just to see, different perspectives. What I learned about the modelling is that, this is a way of bringing, data and statistics into the hunches that are on the community and what's on the ground. So it's a way of, people like myself that might know things anecdotally, but now the evidence is coming from the other side. So it's an opportunity to bring these two together that will help for ongoing funding, but also to help educate us of what's actually needed by the community.
I'm really excited that we're kind of, mapping out the different youth services that are in our area and having a look at what, how to better integrate those. We cover 4 really diverse regions, so having, a good group of people from all of those regions here and talking about those service gaps and what we can do better to get those services talking to each other, but also future-wise, what can we apply for funding to, make those transitions for young people accessing those services easier as well.
As the clinical services manager, to really work closely with my team to be able to ensure that the services that we are commissioning and delivering across the region are meeting the needs of young people now and into the future, and having a real impact on wellbeing moving forward.